The number one asshole, Doc Ellis, a hick doctor from Oklahoma. We're going to talk about why doctors don't want to do legal medicine like VA, federal workers' comp, car wrecks, and yet over 50% of litigation requires a doctor's report, like VA disability, like car wrecks, like Social Security, like workers' comp, both state and federal. We're not trained. Also, the other side's going to call you a whore. Because you are. If you're getting paid by somebody, you're a whore. All right? But you're providing a service. When I started doing legal medicine in the early 70s, there was a doctor here in Oklahoma that would, I'm throwing this white coat away, although I do have a white coat and I got a whole bunch of stuff on the wall, how smart I am as a white coat. Okay, that would write 0% impairment for an operated back with rods. They asked him at a cocktail party, why do you always write 0? Because you can't get any lower. He's a whore. Then another doctor write 50%, didn't matter if it's a strain or an operated back. Neither one touched the patient. So I started doing workers' comp way back in the early 70s. I'm walking down the hall one day with a fellow doctor, wonderful doctor, small town doctor. They never turned me over for collection, just heart of gold picture, okay? Now, doc, if you do much of that the workers' comp, you're going to be known as an attorney's doctor. I'm like, oh my God, I'll lose my salvation. No, I'm really good at this. I really enjoy law. I really enjoy working with juries and telling and explaining the medical aspects of an injury, and that's stupid. But if you spell God, They, and you're worried what they think, don't do legal medicine. I write reports for one guy, Jesus. All right, I had an attorney, an ambulance attorney. Doc, I need 50% on every operating back. I said, Richard, I want to give you 60, because that's your normal, flesh. But Jesus reads my report. If I write 19, they'll get 19. If you get 50, you won't even get 5. Well, he's stupid. He couldn't. I feel sorry for his clients. All right. So if you worry about what people think, you got to call it. Like I was told a vet one time, I said, now I've got all these other things. I'm not going to do your glaucoma. It's not my medical opinion that your glaucoma is contributed by any of your service-connected conditions, and I'm keeping your $500. Right? But now sometimes I will, and you may be able to find case law and other doctors that will write that, and I will not be upset. Right? But you just got to tell the truth. That's the trick. Just tell the truth and let the chips fall. And doctors won't. And this was a video deposition, car wreck, and the attorney for the insurance company was trying to characterize my practice, show that I'm a hired gun and a whore. I said, sir, just stop. I'm a professor of legal medicine. Let me help you out. Let me tell you that probably 98% of the people I see are plaintiffs sent to me by plaintiff attorneys, the ambulance chasing attorneys. Now, really esoteric, difficult environmental things I do for big, large companies. But let's just characterize my practice as most of my patients are plaintiffs asking somebody for money. And of course, the attorney thought that was awful. Well, it's the truth. And of course, the other doctor, when they said, they tried to characterize, oh, I don't do this very often. And he's lying, that's all he does. That's stupid. Tell the truth. Anyway, and then the guy said, well, what's legal medicine? Well, it's different. Legal medicine, let's say you're the respondent, you're trying to save your clients the money, which is your job. Now, if you ask, and you're going to have a doctor's report if there's any medical injury. So you're going to have a hired gun, a whore, to write a report for you. So if you send business to me, I have to guard against wanting to write a big number so you'll send me more business. If you're a plaintiff attorney, but you're a respondent attorney, I got to guard against writing a 0 and say nothing happened. And so I have to guard against that. And so in legal medicine, if someone's asking somebody else for money, I just assume they're a scuzzball and a liar and a cheat, and I do all kinds of little tricks to see if they're telling the truth. Then I think they're telling the truth, I write my report. If I don't, I contact the attorney. Very, 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 very few people are cheating. There's psychological overlay, sure, that when you're in all that crap, that's going to happen. But very, very few people cheat. And then this guy, what are those tricks? Well, I don't tell anybody. I don't know. Okay? And the jury knows that. Because their attorney, they'll get a doctor. Invariably, they'll just lie and say, "Oh, I don't do this very often," and they just fall on their face every time because they're not telling the truth. All right, so just tell the truth. That's all we ask for.